Sharon Ward-Fore. I'm the Infection Prevention Advisor for Metrex. Happy International Infection Prevention Week, everybody. Thank you for all you do to keep patients, staff, and visitors safe. Now, the theme for International IP Week is celebrating the fundamentals of infection prevention. And with that in mind, today I'm going to talk about hand hygiene for preventing the spread of Clostridiodes difficile. Now, transmission of C. diff is similar to other pathogens spread by contact. The patient and the patient's environment becomes contaminated and can spread to other patients. Now, the presence of spores is what makes removal of C. diff even more difficult, although not impossible. Now, C. diff can be passed on to other patients by healthcare workers' hands, shared equipment, or other contaminated surfaces within the patient environment. Now, spore-forming organisms like C. diff may not be inactivated by alcohol, so there may be confusion whether alcohol-based hand rubs should be used. And there actually is no single method of hand hygiene that will eliminate all the spores of C. diff. So using gloves to prevent hand contamination is really the #1 method to prevent C. diff transmission by your hands. So I wanted to share something with you. This is a slide about hand hygiene for C. diff. And according to the CDC, for routine patient care, you should, of course, wear gloves. And after removing your gloves, it's perfectly fine to use an alcohol hand rub for hand hygiene unless your hands are visibly soiled. And hand washing with soap and water is always the recommendation if hands are visibly soiled. Now, in hyperendemic situations, you should wear gloves and wash with soap and water. And soap and water isn't perfect in these situations, but it's what the CDC recommends. So for hyperendemic situations, always wear gloves, wash your hands with soap and water after caring for your patient. And then one other thing to remember is after removing your gloves and other PPE, please don't re-enter the patient room or even worse, their bathroom to wash your hands with soap and water. It's okay to use an alcohol-based hand rub until you're able to find an appropriate sink for hand hygiene. And remember to use products for disinfecting the environment that are on the EPA's List K. So thank you so much. Keep yourself safe and have a great International Infection Prevention Week.